Thank you very much. Yes, so happy to be here today. So, Doctor of Science in Economics, so it is a new venture for me, the kind of policy and the qualitative work. So I'm trying to do my best. I work together with people from global social policy and then as well from Tanzania. So my presentation focuses more on the type of crisis and shock type of context. So the roadmap to the presentation, I'm talking about fiscal space for social protection. We were given 4 questions that I'm trying to address in the first part. Then about the paper findings, more focusing on Tanzania and the challenges and opportunities for social protection in the context of shocks, and then some policy takeaways. So we've done a working paper that came out this year with Rosa Lambin from Oxford and Winnie C. Mwangi from University of Dar es Salaam. And we're working on how can social protection systems in Tanzania be made more adaptive and inclusive in the face of climate shocks, health emergencies, and vulnerable refugee populations. So the paper consists of literature review on social protection, especially for potential humanitarian emergencies, and policy trends, lessons learned from Tanzania as well as beyond, so outside of Tanzania in the literature part. And then we've done in-depth interviews in Tanzania in 24 last year with very important key informants from different policy sectors, senior advisors, different titles, important knowledgeable persons. I'm trying to focus on the fiscal space more, institutional readiness, and then the shock responsive delivery, the focus of the talk. So, what fiscal resources exist and can be mobilized to expand social protection during crisis? So this is the first part of the first question within the domestic, so the government, and what can be done, and first of all, the current government budget, of course, can be used. And there are good examples from LDC countries, for example, also Zambia that we heard, the previous presentation, that government budget has been successfully used to fund social protection programs and during shocks. Also Ethiopia. Increasing also taxes and revenue collection in different ways, to address uninsured populations, and there are also sovereign risk pools. G7 countries are also funding. Ghana has sovereign drought insurance, for example. Dedicated social protection funds for risks. There are different kind of important funds that different countries are using. Then part B. What are some of the international fiscal spaces for social protection in times of crisis? So there's, of course, funding from international institutions. There is, for example, the Sahel Adaptive Social Protection Program, supported by the World Bank, providing loans and grants to several governments for adaptive programs for climate resilience. Then there's humanitarian aid, of course, and development cooperation, UN agencies supporting shock responsive programs, anticipatory cash transfers, all kind of drought forecasting models there. Also forecast-based financing, also financing before the flood has happened, because there has been knowledge that flood is coming. Then there is finance, climate finance and risk insurance mechanisms that we also studied in the paper. Examples include, for example, African risk capacity. When government pays premiums, then payouts occurs. They've paid first premiums to the insurance, and then they get money when the drought hits or something else. And index-based insurances where satellite data triggers livestock insurance payout during droughts, for example. So what are the potential advantages of accessing fiscal spaces for social protection when facing crises? So, of course, strengthening resilience. And we've seen, for example, Niger's Wadata Talaka and Ethiopia's PSNP have reduced food insecurity and improved households' ability to withstand shocks. Then rapid crisis response, which is very important. For example, Bangladesh forecast-based financing enabled cash transfers before floods came on, so flood prediction models were used. And then long-term poverty reduction. So Brazil's Bolsa Familia supports productive investments, agriculture, education, health, and in Ethiopia there is also these, so 80% of these beneficiaries invested in farms. And then, of course, we get from these multi-party programs, there is enhanced government and international coordination for better results. What challenges do countries face in accessing fiscal spaces for social protection for crises then? So, of course, what we're talking about today as well, insufficient funding. Many low-income countries have limited coverage, and they have a very nascent, very new, short history could be in national capacity for social protection. So, for example, when Ebola crisis hit Liberia, it was not an easy task to get the response going. Institutional weaknesses and coordination gaps exist. There are parallel humanitarian and social protection programs that create overlaps. Poor governance capacity and weak data systems. There could be duplicate registries and then causing tensions. There are technical constraints, lack of biometric IDs, inefficient payment systems that delay assistance arrival. Then also, this which is the basis risk of insurance, the inaccurate payout triggers. So there could be a mismatch on what happened and where and what got paid, and then of course too high costs. Satellite data could be poor quality, and then it's difficult to know what to pay and where, or to pay too much. Then what measures can developing countries implement to address these challenges? So, of course, national social protection systems are to be strengthened, and the government ownership is very important to ensure long-term financing. Also to develop social registers, digital payment systems, and mobile payments. These can cut the leakage of funds a lot. Also improve shock responsiveness, adopt anticipatory financing, and then also expand climate insurance mechanisms. Then enhancing international cooperation, so support from United Nations and regional organizations is important to keep in mind, and so then countries can respond fast. And better integration of humanitarian aid and social protection. So there are these, for example, Sahel dual track approach, where track 1 government-led programs and track 2 NGOs fill the gaps where government lacks capacity. And improving data and coordination is also important. So early warned systems that are shared, and clarifying institutional roles of each participant there. So the conclusion for this first part, accessing fiscal space for social protection requires both domestic financing mechanisms as well as international support. The challenges are the funding gaps, weak institutional capacity, and technological barriers. And countries can improve their systems by strengthening institutions, adopting innovative financing, and enhancing collaboration with international actors. So how does Tanzania compare? Well, the system is facing rising pressures and constraints coverage gaps, coordination between social protection and humanitarian response is on a dual track, and a political will alongside opportunities for leveraging technology, public-private partnerships and anticipatory financing are to be kept in mind. So the fiscal space for social protection in Tanzania is experiencing resource limitations and dependency on external funding, especially for their flagship social protection program, Productive Social Safety Net. The fiscal constraints are there. Fragmented governance limits the system's ability to respond to crises. But there exists opportunities for adaptive financing and systemic reforms. So the current program is in some way a bit unsustainable because a lot of the funding comes from donors. While the funding, if you're looking at the budget books, the social protection funding has gone up on health by 18%. Education sectors remain unfunded, and only 43% of the population is covered by essential health services. Then there's public debt pressures. The public debt is rising. The new forecast is 47, and this is of course restricting the fiscal flexibility for unanticipated shocks. And the PSSN covers about 10% of the population. Then there's a little map I made, and it just shows that there are different types of risks, weather risks in blue, illness risks in green, and then also refugees who are vulnerable populations not covered by social protection from the government. The humanitarian experts also agree on this, and they say also local governments lack funds to scale social protection during floods. So there are missed opportunities, there are exclusion and coverage issues. So informal sector is excluded, so majority of the workforce is lacking access to contributory schemes for ensuring their work in times of poverty and unemployment. There's gender gaps. The insurance designs are more male-centric in the way that formal sector is covered, where men are more represented, and women have enrollment barriers due to, for example, high premiums. Then there are systemic inefficiencies. There's outdated data, there's corruption. These came out in the interviews. Then coordination failures. So the disaster management is separate from social protection institutions. Political barriers. So expansion of social protection is undermined by electoral cycles and favoritism in aid distribution. Then resource gaps. Local governments lack funds to scale social protection during shocks. And so the government has not set aside sufficient funds to reach vulnerable populations during crisis, says humanitarian expert. So pathways forward. So there are many social protection needs in times of crisis. And there are system-level solutions and policy solutions. So system-level solutions that came out are revolving around data, better data, forecasting, mapping of vulnerable people, ID card systems, registries, analysis for proactive and reactive social protection responses for identifying and targeting the vulnerable populations. And then mobile money to strengthen access. And then policy solutions, social protection packages for vulnerable groups and needs, expanding the coverage of existing social protection schemes, and so forth. There's more pathways forward. How many minutes do I have? 34 seconds. Okay, great. And so the challenges are that there are resource limitations, funds mismanagement, poor coordination, data gaps, low coverage of existing social protection schemes, lack of political will, and limited public awareness. But the solutions, clear response parameters and triggers that activate the social protection responses when various shocks are hitting, establishment of a shock response planning and coordination unit within the Prime Minister's office, and strengthened training and capacity building across sectors, and enacting legislation to support rapid disbursement of funds in emergencies, expanding overall access to social protection also within the informal economy. This is the synthesis of stakeholder views. I think my time is soon up. Just as a concluding remark, I would say embedding shock responsive elements are not only imperative for building resilience, but also essential for advancing the Sustainable Development Goals. Thank you.